Welcome back to another episode of Hala City Podcast. Today we're talking about vertigo and dizziness, maybe a condition people don't really understand. Today I have Dr. Nanor with me. So Doctor, tell us a bit about yourself and what do you do for Mediclinic?
Thank you for this introduction. I'm Dr. Nanor Tchaghlasian. I'm an ENT specialist. I have a European Board in ear, nose, throat and head and neck surgeries. I have international diploma for diagnosis and treatment of vestibular or balance disorders. I work in Mediclinic Creek Harbour and in Dubai Mall.
Both nice facilities. I love Dubai Creek. It's brand new to us.
Yes.
And Dubai Mall obviously
It's
is just
very,
a
very
nice
beautiful clinic, yeah.
So what is the difference between vertigo and dizziness?
Let me start by saying that vertigo and dizziness, both of them are symptoms for diseases. They are not diseases. Like runny nose or cough, it's a symptom for flu. Vertigo and dizziness are a symptom for diseases that affect balance organs. So vertigo is sensation of something spinning around you, like a sensation that you are in the roller coaster. Dizziness is sensation of lightheadedness or as you are underwater or sensation of rocking. There are many things which patients describe me like dizziness or out of balance as they are going to fall down. So all these things we can consider dizziness. But both of them are symptoms for balance disorders.
So why would I be dizzy?
Let me explain like this. If I will touch this one, I will feel this is cold or hot. How can I feel that one? There is a special receptors in the skin of my hand which will take the this sensation, this signal with nerves, special nerves to the brain, and the brain will interpret and tell me that this is hot. The same issue is with the balance system. So there are organs and receptors in these organs which will take the signals from the environment external of our body from outside and signals from our body, parts or organs of our body, and will send these signals throughout the nervous system to the brain. The brain will take these signals and will know the position of our body according to the external world and will balance our body. So what are these organs which are responsible for this? One of them is the eyes. So the eyes will tell us this is the horizon, this is right, this is left, there is a stone, there is a step. The second organ is our inner ear. Our inner ear will detect the movement of our head. Head is right, head is left, head up, down. Will detect the movement of our track, of our neck. And all these signals, it will go to the brain. The third organ is proprioceptive system, which consists of the skin, muscle, and joints. If you stand on a sand or you stand on a stone, how you will know? This is your proprioceptive system telling you that you are standing on the sand and not on the stone. All these signals will go constantly to the brain to be alert about our movement and our body or parts movement according to our gravity center. So if there will be any defect in these organs or nerves which takes these signals or the brain itself, we will have dizziness or vertigo. So there are many diseases which give the dizziness or vertigo.
So what is the common reasons for dizziness?
The most common one which I see in my clinic, and mostly more than 70% is BPPV, is benign positional paroxysmal vertigo. It's an attack of spinning vertigo for seconds, triggered by head movements up or down, or triggered by lying down. The patient usually come and tells me that I am having this spinning vertigo whenever I'm lying down on the right side or whenever I'm lying down the left side. So why this is happening? Usually it is happening because there are small crystals, carbonate calcium crystals, which has to be stuck somewhere inside the inner ear. they will become dispatched from its place, and it will be free in the semicircular canal. So whenever the person will move, the crystal will move also and will give this kind of spinning vertigo. So this is very common in the patients.
Okay. What about vestibular, probably the pronunciation is bad, migraine? Maybe you can pronounce it correctly for me.
Vestibular migraine. So
this is why you're the ENT doctor.
It's all we know about the classical migraine is the attack of throbbing headache which affects one side of the head. It comes as an attack. At the same time, sometimes migraine will come with attacks of vertigo, dizziness, nausea, and vomiting. So the attack will last more than 12 hours or 24 hours. It will go more than 1 or 2 days. With the attacks, the patient will have photophobia or phonophobia, so they don't like the light, they don't like the loud sounds. Usually you see the patient will go to a dark room and will sleep without any movement. This is called vestibular migraine. And some of the attacks will accompany by headache, migraine headache. Some of them will come only as a dizziness or vertigo without any headache. So the second common cause usually that we see in our clinics is the vestibular migraine.
And what tests are done to diagnose?
Usually if there is dizziness or vertigo, there will be a kind of abnormal eye movements, which we call it nystagmus. So all the tests that we do in our clinic is to look inside your eyes and to see if you have any kind of abnormal nystagmus or not. So it could be only by examining with the eye without using any machines. So we call it bedside test. And it could be by using a special machines, which one of them is video nystagmography, is a goggle that we put on the eyes and we record the eye movements. Because sometimes the nystagmus will not be seen by the eyes. For this reason, we need to put the goggle and record the eye movements in dark environment, so we will be able, if there is any hidden, to see if there is any hidden nystagmus or not. And from the type of the nystagmus and the direction of the nystagmus, we will be guided to know from where is this problem. Is it something related to the peripheral organs like the eyes or the ears, or it's something related to the brain? So mainly we rely on this test to verify the place and where is the disease, to know where is the disease.
So once you've made a diagnosis for a patient, what would be the medical management for that patient?
The medical management will rely on the reason. So if it is vestibular migraine, the treatment will be as a migraine treatment. But if it is BPPV or crystal issue, usually the treatment will rely on some maneuvers or some movements for the head or body to put the body in different positions, the head in different positions, to bring back the crystal to its place. So we can do one maneuver which will take only 2 minutes, and we can treat the disease without any medication or without anything. Apart, if it is something else, if it is something related to the brain, at that time the treatment is could be surgical. So it is related to the cause, the treatment.
When should one of our patients be worried? When is the dizziness serious enough to attend the emergency department? When would you say that?
I will tell the patient to visit the nearest emergency department if, plus to the dizziness or vertigo, they have very severe headache which prevents them from sleeping or waking them from their sleep. If they have chest pain, in addition to the vertigo, if they have a weakness in one of the legs or one of the arms with double vision or slurred speech, they have to go to the emergency. If they have high fever, They have very stiff neck. They have to visit, and if they are not able to stand up and to go to toilet by themselves, they need to go to the nearest emergency department.
Thank you, doctor. I think you've been very clear about the differences between the dizziness and vertigo. But I think if people are worried, they should book in to see you and get checked out.
Thank you, Aaron, for this meeting and for this opportunity. I hope you don't experience vertigo or dizziness at all in your life.
Well, doctor, if I do, I'll be coming to see you in clinic. Thank you so much for today. I really enjoyed understanding the difference between dizziness and vertigo. At least there is treatments out there to look after our patients. Thank you for joining us at our podcast today, and we look forward to seeing you soon.